This is the third portion of the PEDS health assessment. These are all concepts we're going to talk about. You have to know PEDS before you can take your exams. It's very simple. These are vulnerable patients that you have to be familiar with. Okay? What do you guys think? What should be the next response? A nurse is caring for a HIV patient. You have to be familiar with this. Precautions, what you do with them, medication they take, because now it's normal. You see a bunch of people with HIV, you have to know how to take care of them. We just delivered a baby boy. The client asks if it is okay to breastfeed the baby. What do you think? Buzzwords, breastfeeding, HIV, whether it's okay. It's a question. You have to be therapeutic. That's all. But then you have to know a little bit of content to answer the question. Why do you want to do that? Yes, you can breastfeed your baby. Question mark. We recommend you bottle feed the baby to avoid risks of transmission. We recommend you breastfeed to avoid malnutrition. What do you think? There's a content here. There's a reason why I said this question is very, very important. There's two things you have to know. HIV patient is based on location. If they are in a place where there's more, like in the third world country where they have nutritional issue, you treat them different. If they are in the developed countries, you treat them different. If they are in developed countries, you should not let them breastfeed because we have a nutritional supplement that is very effective as breast milk. And so we ask you not to breastfeed, rather bottle feed your baby. But if they are in the third world country, they cannot afford to buy these bottle feeds, and lack of bottle feeds will cause problem for the baby, malnutrition, and they can die from it. So those people, we allow them to breastfeed, even though they have HIV. You let them breastfeed, and you give the kid medication, prophylaxis. And so this is not therapeutic from the first go. Yes, you can breastfeed. This is incomplete statement. You got to tell them the reason why, but they cannot do that. This is for third world people. If you're in a third world country or underdeveloped, I don't like the word third world, underdeveloped countries, it's okay to breastfeed if you have HIV, except the kid may need some medication as a prophylaxis. This is what we do. According to CDC, we ask you to bottle feed because the bottle feed may be equivalent to the breastfeed. This is what you do in the third world country. You breastfeed to avoid malnutrition despite having HIV positivity. This is built on that. If you have to know what the HIV patient is, it's a select on the fly. Which of the following indicate correct understanding by the nurse? That means the nurse should understand the situation. A nurse is caring for HIV positive client who just delivered a baby boy. The client wants to know when the baby will be tested for HIV. When would the baby will be tested? Buzzwords, HIV positive client. When am I going to be tested? Which of these answers indicate that you understand, the nurse understands? So like I said, try to make the question easy. HIV positive, want to know when the baby can be tested, and which of these answers, if you pick, indicate that the nurse understands what is going on. It's straightforward. What do you guys think? You have to know this. It's like immunization, how you know certain schedule for certain medications, certain immunizations that the kid is supposed to receive is the same thing. There's a schedule for these kind of things when you you deliver a positive patient or patient, if you are HIV positive and you deliver a baby, we have to test you more frequently. But how do you do that? There's 5 answer choice there. You don't have to pick all of them. Just pick that you know. No brainer, right? As soon as they're born, they need to be tested. That one, it's a free answer, right? That one is free. As soon as you deliver, we got to test your baby to make sure you don't have transmission. But what is the frequency? When is the next one? Is it 1 to 2 months? Is it 3 to 4 months? Is it 4 to 6 months? 8 to 10 months? How many times? Is it 1, 2, 3, 4, 5 times before we're confident? At least 3 times. Okay. The next one is 1 to 2 months, followed by 4 to 6 months. So these are the frequency. At birth, 1 to 2 months, and 4 to 6 months. If all of them negative, we're very sure that there's no transmission to the baby. So that's that question. And this, I know everybody knows this, but if they said it in this form, I try to confuse you a little bit, but not to confuse you, like keep you on your toes. This is a question to keep you on your toes. And Nancy is caring for 4 clients, which client situation is very concerning. And you can see from the screen, I'm trying to test certain knowledge. RH negative mother had a RH negative first baby. Now she's pregnant with RH positive pregnancy. RH negative mother had a RH positive first baby. Now with RH negative pregnancy. RH negative mother, RH positive first baby, now with RH positive pregnancy. RH negative mother, RH negative first baby, now with RH positivity pregnancy. What do you think? Which one should give you a pause and worry about the baby? What do you guys think? Like I told you, it's all concept. You have to know RH incompatibility, and that's what this question is testing. Which one you think is not right, that the baby is going to get into trouble? It's something you have to be familiar with. They can ask you in OB, maternity, and it's a concept. They are RH negative, so you know you can do anything about it. Then you look at the second one. The second one is the most important. The third one is not that too much. You have to base on your movement from your second one. Then you go to the third one. So which one of this is more dangerous? By a pregnant lady giving birth to who? If the RH negative and give birth to RH negative, then it's not a problem. The problem, this is the concept. RH negative mother had a RH positivity baby, and then she formed antibodies against this. Therefore, every time she see RH positive baby, it's going to kill her. It's going to attack it. That's all. That's the concept. This is if you read a book, they'll give you a paragraph about it and make it like 2 sentences, right? RH negative mother, have a RH positivity baby. Isomerization, basically, from antibodies. And then you should not see any more RH positivity. If you see them, you're going to destroy them. So which one? It's not going to be this because it's RH negative. It's not going to be this, it's RH negative. It's between the two of this, RH positivity. But then the subsequent pregnancy, this was RH positive. This is RH negative. So the antibodies cannot attack this. So the right answer is this. Just a straightforward question. Put it in the case form, question form, and it looked intimidating. I mean, it looked Don't let the answer choices intimidate you and just run away from me and choose an answer. Sit back, break the question down, use the concept. You know what to do, and you just write it and go and pick up the answer choice. Don't let them intimidate you with their diagram, whatever they give you. Okay, I just intentionally did it like that to feel like it's a very complicated thing. No, it's not. This is the same thing. Like I said, I like Pete, so a bunch of Pete's. This is the series 3. Stay tuned. And if you don't subscribe, look down, adapt NCLEX. You learn a lot and you'll be golden. A nurse is caring for a client who just delivered 2 twins. No, delivered twins. One was a still baby. Which recommendation from the nurse is appropriate? This is very sensitive issue. You have 2 babies. One is dead. It's a twin. What do? You, the nurse, what do you tell the mother? Pay attention to the living child. Avoid showing emotion. You just deliver. And one of them die. Why you shouldn't show emotion? Maximize time with the stillbirth baby, the person who's dead. Grieve for the dead child and spend time with the living child at the same time. There's no right answer, but there's ethical ramification. At the same time, human nature. This question requires human nature and be therapeutic. What do you want to do? If you are in that situation, what do you tell the mother? Like I say, you have to be therapeutic, but at the same time, you got to be human. So what is the right answer? I won't fault you if you pick anything else. But there's a better answer choice over there. Pay attention to the living child. The baby that is dead is gone forever. Pay respect. So this is gone. It's supposed to show emotion. This is gone. If you spend time with the still baby, then you forget about the living one. And all you care about is you become a problem. So this is a dynamic problem. It's very difficult, but you have to look at them both at the same time. Simultaneously, while you're taking care of this, you're also taking care of the baby. You're grieving at the same time, you're happy. You got to split it. Grieving and being happy. So this is what you do. But it's a difficult question. It's hard. Nobody will teach you, but you have to think about it. You have to grieve at the same time. You got to show happiness. That's okay. Number 5. A nurse is caring for a 2-month-old child. Which of the following is concerning? When they give you this kind of question, all they asking you is, what do you think? Which physical finding is bad? But don't answer the question until you look at the age. There's a reason why I give you the age. So don't go away from it. So the buzzword is a 2-month-old. What do I expect in the 2-month-old baby? That's what the question is asking. You see a heart rate of 115, some chest retraction, nasal flaring, respiratory rate of 30, and audible grunting. Even if you don't know, there's some words there that sound like a B-sharp moment that you should be so quick to pick them. But it's a select or apply. You don't have to pick all the 5 if you think. If you know 2, just pick it and move on. Right? So what do you guys think? Which of this is very concerning? Which of them? The heart rate of 150, chest retraction, nasal flaring, respiratory rate of 30, and audible grunting. You already know it's a 2-month-old. I mean, their heart rate run between 110 to 160, and when they cry, go to 180. So this is normal, right? Their respiratory rate is 30 to 60. So this is normal. This word retraction, it does not sound like something that should be normal. How can retraction be normal? Nasal flaring, that's they having respiratory distress. That's the behavior. So I put this word to tell you these are what I call buzzwords. If they give you a pediatric case and they're describing it, look at this word: chest retraction, nasal flaring, audible grunting. Those are not normal finding in the kid. It should not be a normal for you to pick it. So chest retraction, nasal flaring, and audible grunting. These are all airway respiratory issue in a pediatric patient, and you should be quick to identify them as abnormal features in this 2-month-old baby. You don't have to pick all of them. If you already know 2, yeah, 2 out of 3 is better than 0. So don't worry, don't be afraid of select or apply. As you can see, most of my questions are select or apply, and I don't want you to struggle. I just want you to use your content to pick the answer that you know and move forward. Don't worry about trying to guess whether the other one is right. Just pick those you're confident and you'll be fine. It's that simple. And then the dreaded developmental cases, everybody ran away from it. There's some people who are very good at it. You can pick some of them if you've had a baby before, you know. Some, you just have to try your luck. 6-month-old, there is a reason. When they give you a pediatric patient and you see month, they give you age, please step back. Don't even rush. Think 6 months old. Put yourself in that situation. 6 months old is a buzzword. 6 months old client is in the pediatric clinic for a well baby exams. Which of the following is concerning? That means I should not see. The same question we saw, I should not see this finding. Moral reflex is present. Babinski is present. I try to make this hard as much as possible so that you can study these features. Able to roll from front to back. Pick object when it falls. Pencil grab is absent. Object prominence not achieved. Think about it. If you know it, it's easy. But if you don't know it, it's going to be hard. Which of these is concerning? It's 6 months old. 6 months old. Moral reflex is still there, present. Babinski is present. They're able to roll from front to back. They pick object when it falls. The pencil grab is absent. And object prominence not achieved. What do you think? What do you think? This is a hard one, so you got to look at each of them and think about it. Moral reflex, this goes away in 3 months. It's still there. I'm worried about this. Babinski is still present. Why? It takes like 12 months. Up to 12 months. So that's fine. The kid is able to roll from front to back. Yes, you should achieve this by the 6 months. So that's good. That's not a problem. They can pick object when it falls. Yeah, that's what they do. Pencil grab is absent. And that is normal, right? This is like 10 to 12 months. Some people will say 9 months. I think 10 to 12 months is the best way to get it. You established it. Object permanence not achieved. Yeah, because they are not 9 months old. Object permanence means you show them something and you hide it. And they know it's hidden. They will look for it. They don't go away from it. They will try. They know that you hide and seek. Yeah, they will try and find what is going on. So if they've not achieved it, it's 6 months. So it's okay. The only thing is one answer. is only one answer choice. I intentionally said this, but this is a hard one. You got to go through all of them and see. The age may different, but the classic object provenance is 9 months. Pencil grab is 10 to 12 months. Some people will say 9 months. But 3 and 4, the 6 months old, you should be able to do that. Babinski can go up to 12 months. And Moro reflex should be gone in 3 months. Of course, this is my question. I said it, so I made it so hard. NCLEX would try to be nice, but this is just to help you, know all these key developmental stages that you should be familiar with. I just put them together and pick an age to show you which one is. So the one that is concerning is only one answer choice. That's Monroe. Therefore, if you pick more than one, you get 0. This is also one simple concept. Select and apply. Which of the following the nurse you expect, right? A newborn delivered 5 minutes ago is cyanotic. That's all. One word, cyanotic. Newborn, just delivered. It was just delivered, cyanotic. Which one should the nurse you expect? Maybe the problem where the kid is cyanotic. This congenital heart problem. Rewrite the question. That's what I always say. Pay some time with the question, and then you figure out what the examiner is asking you. The baby just get born 5 minutes ago, and it's cyanotic. Why would it be? It's because there is what? Right to left shunt. Which of those is a right to left shunt? This is how you break down the question. Now you have a focus. You don't looking at the examiner question and say 5 minutes, cyanotic, 5 minutes. What is he trying to say? It's because he's asking you about right to left shunt. Which of the following is a right to left shunt? That's all. Which of this is a right to left shunt? It's very straightforward. If you need help, this congenital, I have wonderful, great videos, a bunch of them, a couple of them, describe it so easy that you know all the congenital pediatric heart disease and which direction they go. There's a left to right and right to left. Right to left will make you blue. Remember the terminology of Foley? Yeah. Pulmonary stenosis, right? Right ventricular hypertrophy, right? You have a ventricular septal defect and overriding of the aorta. How is the right side going to give blood to the left? It's because it passes through the ventricular septal defect. Right? So this is a right to left. That's why the kid is blue. So the best way to remember them, right to left, is the T's. They have all the T's. Truncus arteriosus, atresia of the tricuspid. You have tetralogy of Foley, transposition of the great vessel. They always start with the T. That is the key word. Start with the key, the T. Atrial septal defect will not make you cyanotic. This is left to right. Ventricular septal defect, it does not have a T in it. Left to right. PDA is left to right. I said T and T. So 2 and 4 are your right answer. They are the one that will make you cyanotic. Okay? Like I said, I have some videos for you. You can watch them. Number 8. How should the nurse respond? A 5-year-old client was seen in the pediatric clinic for a pink eye. Follow-up. The client has been on antibiotic for 24 hours, and the mother wants to know when the client can go home to school. It's just a concept. When can I go to school? Rewriting it. I've circled the bars with pink eye, antibiotic for 24 hours. When can I go to school? I want to go to school. When can I go? You have to know how to teach this patient. These are all PTs. Most of the cases, PTs is like that. Mommy will cry. Baby has a pink eye. He's taking antibiotic. When can we go to school? Tell me. You can't go to school until no more drainage. You need to wait 5 days more. You can go to school tomorrow. You can go to school with a mask on. Which one is that? Which one is that? It's a concept. When you have conjunctivitis, a pink eye, you are not more infectious. You are not more infectious after 24 hours of antibiotic. 24 hours of antibiotic, you are good. So the kid can go to school because he's been on antibiotic for 24 hours. That's all. You see the concept? If you say it to yourself, then you look at the answer, you say, oh, I'm looking for answer, baby going to school today or tomorrow. And the only thing that I say is that is he can go to school. Find the concept and look at the answers, and you will find the answer there. It will be similar. The answer choice will not be written the same way, but it will be similar with what you expect based on your content. And so find a place that will give you the best content you can have, like a weapon. You go like a soldier, you know, you're all armed from left to right. You have a braceplate like a hammer, you know, you have a hammer, you have bullet everywhere, you're going to fire everywhere, whenever they bring it, that you pack with knowledge. Okay, and a little bit of test taking skills, you'll be fine. The test is not going to trick you. They have no question. If they're going to ask you question on conjunctivitis, they're going to go in here. It's always part of the, if it's this case, they give you a case study, they will always go to this question on the board. The mother will want to know when the baby can go to what? School. They will ask you what kind of different kind of conjunctivitis. There's bacterial, viral, and the chemical one, right? And all of them, the two that are the most infectious ones are the bacterial one. And you have to know when the baby can go. Of course, you got to know what kind of precaution you place this late patient. You know it, right? Contact. And they have to be careful. They have to wash their hands. It's most important. As soon as you start antibiotic, you're ready to go. 24 hours. That's all. Number 9. Which room assignment is appropriate? When it comes to room assignment, I always have one word. So if 5-year-old client with impetigo need room in the peds ward, which room assignment is? If you watch my prioritization, you see that prioritization is going to be easy. There is always 1-2 words. Same organism, not the precaution. We can have contact precaution. All of us can have it. But if we don't have the same organism, yeah, we can be together. We can have airborne. We both are airborne precaution, but so far as it's not the organism, you can't put me together. It's that easy. Parvovirus B19 is contact. You can't be together. Scabies is the same thing. Then the next statement is you cannot infect anybody. Immunocompromised, stay away from them. So same organism and don't infect the other person, especially if they're immunocompromised. So don't put this guy here. He's a leukemia patient. He wants to be left alone. Leave me alone. So the only room he can go is somebody who also have impetigo. Same organism, not the precaution, and don't infect anybody. It's just a concept. You take it with you every time you go. Whatever the case is, if they're asking you room assignment, say adapt NCLEX said, same organism, and don't infect anybody. And don't worry about the precaution. You can have the same precaution. So far as it's not the same organism, I'm not picking you the answer. And you write it down, you look at the answer, it's right there. They're not going to trick you. They will do that to you all the time. Of course, you got to know how to take care of the kid when they get hospitalized. It's very important. You need to teach them. The nurse or the new graduate need to know how to deal with them. A nurse is teaching new graduate about nursing care during procedures for different age group. Which of the following is appropriate teaching? Select or apply. Buzzword, right? Nursing care for procedures, different age group. They are in a hospital, you're about to do a procedure. You're going to place IV. You're going to put the NG tube in. Whatever you're going to do, there's a principle for this, right? Select or apply. I make this select or apply to make you confused. Which of the following is only 4, but it's select or apply? Which of the following is appropriate teaching? A toddler, tell them it will hurt. Okay, just tell the toddler that, hey, it's going to hurt. Whatever we're going to do is going to hurt. A preschooler, explain using magical thinking about the procedure, right? A school age, explain how it is going to feel, you know? An adolescent, tell them the effect on the body image. I just took the principle for hospital care for all these groups and I made it a question. NCLEX also will do the same thing. They don't have anything to ask you. It's just like the principle, right? The toddler, do you tell them that it's going to hurt? The preschooler, did you explain the thing using magical thinking? School age, do you tell them how it's going to feel? And adolescents, you tell them the effect on your body. It's select or apply. So which one is appropriate? That means which one is correct? Which one do you think is correct? You don't have to pick all. There may be one answer there may be 3 or all 4 are right. All right, so you got to pick your poison. Which one it is? There's few of them that is straightforward. We know the preschoolers, they always have magical thinking like things. So this one is no brainer. And those adolescents, they care about their body. You know, you look at their body, the way they look, their face, their everything. So you got to tell them, if you're going to pinch me, I need to know about my body. How is it going to affect me? You're going to destroy my face? The school age people, they ask a lot of questions. So you got to let them know how he's going to feel. A toddler does not even care. You will just cry. All you need to talk to is the mother and let the mother know. So the only thing is 2, 3, and 4. This one, you don't need to tell them it's going to hurt. Just those people, you tell them, the school age people. But these people, you just talk to the mother. The toddler, you don't just, they don't need to know that much. So you tell the mommy, hey, this is what you're going to do. There's no any explanation for that. So 2, 3, 4 are your right answer. Number 11. Same concept, right? A nurse is caring for a 3-year-old. You see, the age is very important. Admitted for ear infection. Which of the following the nurse should include in the plan of care? This age group, very, very specific. There's certain things you have to do for them so that they do not regress. I call them the R's. You want to avoid regression as much as possible in this age group if you put them in the hospital. And so I call them the R. If you want to learn them, just looking for the word R in every answer choice. If you don't see the R, you're going to make them regress. So I call them, look for the R, otherwise we are going to regress. So look for the R, then they're going to regress. If you see an R in the answer choice, pick it. They may describe it, they may not put an R there, but just when you change it, it's the same thing. Those age group, look for the R, right? Reassure them. There's the R there. Make them look normal as much as possible, ritualized. They are there. There's an out there, right? There's a routine here. Home, ensure home routine as much as possible. There's an out there. There's an R here, right? Adequate rest. The only thing that doesn't involve R is this: promote independence. So you give them choices, 1 and 2, and let them pick one so that they will become independent. That's the age group based on Erickson classification. So I call them, they are the R's. So reassure them, ritualize their stuff, make things routine as much as possible, let them rest. If you don't do that, they're going to regress. We want to avoid regression. So we give them all the R's. And at least you should promote independence by giving them choices, 1 to 2, and then they will pay attention to that. They can select, it make them more independent as if they're in charge. So if you don't forget everything today except don't forget the R's. I mean, that's the easy way to remember them. Reassure, ritualize, retune, rest in order to prevent regression of this age group. Okay. And number 12. This is also another concept you have to know. Most people don't know that there's separation anxiety. There's stages. The kid has to go through these stages. If you have babies, you know, you can tell. A 9-month-old, this is the classic age where they undergo separation anxiety. A 9-month-old boy has refused attention from the caregiver and cries nonstop. You should say when the mother went back to work. So when the mommy went back to work, he's been crying nonstop. The nurse know that this is described was. So 9-month-old, mommy went back to work. All he does is cry. He does not want any care from the caregiver, and he cried nonstop. Buzzword. He cried nonstop. He cried nonstop. So you see what I'm doing? 9-year-old, I focus on that. Buzzword. Caregiver, non-cry. Those two things. He does not want any attention from the caregiver, and he cried nonstop because the mommy went. 9-month-old, separation anxiety. Okay, fine. Which stage is the kid in? Protest is when they care, they cry nonstop. They don't want anybody to take care of them. They will cry until mommy come back. They're protesting because mommy is gone. So I'm just screaming until mommy come. I'll be mentioning mommy name. Mommy, 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 where are you? And nonstop, they're not going to do anything. That's protesting. Despair, they realize that mommy is not coming. So what they do, they start regressing. They start acting like a baby, like 6 months old. They're not going to eat. They're not going to do anything. They stay there. They're not crying anymore. But they're regressing, going back. They're doing things that they used to do as a kid. So they don't progress anymore. They're acting out basically. That's despair. So they regress. They start doing things that they used to do later on instead of trying to progress. Then detachment, they realize that all the things they do, nobody is going to help themselves. They have to do something better. So then they detached. And then they said, okay, I'll welcome any help from anybody. So they forget about their mommy and they start forming relationship with the caregiver. There is no separation stage. So that one is gone. So these are the stages for separation anxiety. So this patient is refusing care from the caregiver and cry. It's not in the despair. The despair, they don't cry. They just basically regress. They go downhill because they're mad. They don't talk to anybody. Mommy is gone. Fine. I'm on my own now. I'm just doing whatever I want to do. I don't want anybody to touch me. Nobody. They don't talk to anybody. Don't cry. And detachment, basically, that's when they form more new relationships. They become open. So this is a protest stage. It's just protesting that mother is living. There's no separation stage, that's all. 9-month-old is in the PED outpatient clinic. Which of the following developmental findings the nurse should expect? Which one do you expect? Is a 9-month-old. What do you expect? Move object between hands, pencil grab, stranger anxiety, say mama, move to sitting position. Like I said, this kind of question, they are not hard, but there's some key ones you have to know. And that's what the NCLEX like to ask. That's why I put them there. These are the ones they like, you know, they are milestone they achieved and you know they're growing. So which one you should expect? I told you about this already. That 10 to 12 months is the best time. So it's a selected apply. You don't have to pick all of them. But 9-month-old, you should be doing this. Stranger anxiety is there. 6 months old, you should be saying mommy, the mama, mama, mama. Dada, you say it like 9 months. So mama, you should have it. And 9 months, you should be able to move to the sitting position. The only thing that doesn't apply is this. They need 1 more month, 10 to 12 months before they can do that. So 1, 3, 4, and 5 are your right answer. Okay. This is another problem. Selected apply. 7-year-old was hospitalized with chickenpox. Which of the following statement made by the nurse need immediate intervention by the charge nurse? Chickenpox. There's only 2 words. Chickenpox, immediate intervention by the charge nurse. That means that the nurse made some wrong statement. Client is infectious 2 days before the rash. Yes, when you have chickenpox, infectious 2 days before the rash. Client remain infectious 7 days after the rash. Yes, at least 5 days, 5 to 7 days, you're still infectious. So close to a total of like nine days. Some people will say 5 days, but 7 days, a week is usually you're still infectious. Client will need airborne and droplet. You don't need droplet, you need contact. Client is still infectious with crusted vesicles. When the vesicle get crusted, you are no more infectious. Client will need vaccination after the infection. No, you get infection, no more vaccination. Which one need immediate intervention? This one. 3, 4, and 5. You don't need droplet, you need airborne and contact. You are not infectious when you have crusted vesicles, and you don't need vaccination after the infection. So those are the ones they need to intervene. And the last one, for the road. It's a straightforward question. You know it or you don't. Which of the following is associated with fat embolism? A 7-year-old is in the PEDS ED with fracture. You got to know your fractures. How do you know your fractures? Spiral fracture, open compound fracture, crash or compressed fracture, or green stick fracture? Which one? High risk for fat embolism. When you take test, use language. Use language as much as possible. Fat embolism. Fat embolism. That means you have to do something to the fat. That's the way I take test. For the fat to be able to embolize, you have to do something to it, really bad. So which one of this I've done something to the fat and it has embolized? If you do like that, you need the answer choice will pop at you right away. You have to like really disturb the fat inside for them to be able to embolize and go somewhere. That's the way I break the question. I did not use anything. I know fat embolism language. Which one? They are fractures. Which of these I have to like actually disturb the fat inside the tissue before the bone can embolize those fat and go away? What do you think, guys? Which of this you have to do that? It's no brainer, right? You know what spiral fracture is? This is usually if you get abused, it's a sign of abuse. Open compound fracture. That means the wound is open, the bone, the skin is broken. You can see the bone itself and there's fracture in it. Grain stick is incomplete fracture. And crash and compressed. Yeah, if you crash and compress, you break the bone into pieces, all the fat can embolize and become a problem. And so you're using the language, their own language, and changing it into that test taking strategy. This is your answer. Thank you for playing Adapt English game. All the best of luck. Good luck. And take care of yourself. Bye.